Hi, everybody. Getting a life-saving organ transplant is usually a top priority, but right now, people on waiting lists are wondering how much longer they'll have to wait because of COVID-19. Dr. Oscar Serrano is a transplant surgeon at Hartford Hospital. He is joining us now. Thank you so much for being with us.
Thank you for having me.
So are transplant patients at a higher risk for COVID-19?
That's actually a very interesting question, one that the transplant societies, transplant surgeons, transplant physicians have been asking ever since COVID-19 became a relevant health issue. As we know, or the little that we know about COVID-19 is that it is a viral illness that one acquires, but many of the manifestations of the illness are as a result of someone's immune reaction to that virus. So with transplant patients, we have individuals whose immune system is suppressed. We put them on lifelong immunosuppression. And so from the very little that we know so far, it appears as though transplant patients experience the whole myriad of manifestations, going from a very mild flu-like illness all the way to catastrophic outcomes. So to answer your question, we don't know yet enough about the illness and how it affects transplant patients, but there certainly seems to be a wide spectrum of illness manifestations.
Are transplant surgeries, for the most part, on hold? Are they considered elective?
So transplant surgery is not considered elective surgery in many cases. A lot of our surgeries, in particular living donor operations, or living donor transplants have been put on hold. We at Hartford Healthcare have been very selective with patients we have been transplanting through this pandemic. We try to select patients whose acuity is so high that they may not survive in the short period of time. In addition, especially for kidney transplant patients for whom dialysis is always there as a backup, we try to select out patients who may receive an offer from a donor who immunologically resembles them. We know that if you receive an organ from someone who is very similar to you in terms of their immunology, then the life of the transplant would be much longer than for those that if we were unmatched, as we call it. So transplant surgery has not stopped at Hartford Hospital yet. We don't know if it will cease completely as it has in some other programs, but we continue to do them only in the highest acuity patients.
I know you just had an emergency transplant that happened recently. Can you tell us about that and how the patient is doing now?
Well, the transplant that we performed last week was for a patient who had a very high acuity, as I just explained. So they happened to be in the ICU. They were fairly sick, and based on the scoring system that we use, their survival in 3 months would have been very close to 0. And so if we did not find them a organ, they probably would have died. And so it is only under these circumstances that we continue to do transplants at Hartford Hospital.
And is that patient doing okay now?
The patient is currently still hospitalized, as would be expected. They are recovering from their surgery. Liver transplantation is a very high-risk surgery, and so they are still in the recovery process. It's too early to say when they will leave the hospital.
So what happens then, and hopefully this won't happen for the case you're just talking about, but I know that some are concerned if a transplant recipient then starts to develop flu-like respiratory symptoms, what happens then?
So flu-like symptoms in a transplant patient are very, very common. So even before COVID-19 was around, our instructions would be for that patient to seek medical assistance. So either going to their transplant provider to be evaluated. Many times these patients would be admitted to the hospital, get a full workup, including viral illnesses, including other coronaviruses not related to the current COVID-19 coronavirus. And so our protocol still continues to be the same. Many of our patients call us with these type of questions, and our recommendations are to continue to do the same. Come to be evaluated mostly at the hospital, We will prefer not to send them to the emergency department because there they would be exposed to patients who potentially have COVID-19. So the protocol is still the same. They come into the hospital, they get evaluated, they get a full workup, and now, in addition to all of that, they get tested for COVID-19.
Well, we thank you for all that you're doing. I know it's tough for the people who are waiting and probably hard to determine when they could actually be taken for a transplant, but glad to know that those who are in dire need of it, it's still going on. So we want to thank you for being with us. I'm speaking with Dr. Oscar Serrano, a transplant surgeon at Hartford Healthcare. Thank you so much for being with us.
Thank you.